Good morning, guys, or good afternoon to everybody in here. My name is Ricardo Ramirez, and I'm currently a respiratory care practitioner that happens to practice in the state of Illinois. I currently work for Rush University Medical Center, and I recently acquired my credential on acute critical care specialist. So today, you guys, I'll be talking about reducing COPD deaths in adults. And the reason I want to talk about this topic, it's because I think I've taken care of multiple patients that are diagnosed with COPD, but at the same time, majority of these patients do not understand how to follow a COPD action plan due to their level of literacy and the knowledge and understanding about their own disease. So today, we'll be talking about this main bullet points pretty much. So this presentation is going to contain information about the definition of COPD. It's also going to have COPD statistics that's in adults. It's also going to talk about COPD stakeholders in Illinois. We'll also talk about the Respiratory Health Association, and this association is actually in the state of Illinois, and you know, the education they provide and the things they advocate for here in the state of Illinois. We'll also be talking about the literacy levels in Cook County, and the reason I'm going to talk about that is because I actually currently reside in Cook County. As well, we're talking about health literacy and health outcomes in COPD patients. Alright, so let's just dive right into it, and we're going to start primarily with the definition of COPD. So what is COPD? COPD stands for chronic obstructive pulmonary disease. So this definition that I will provide to you guys, actually, I got it from the book of Fundamentals of Respiratory Care. This is actually a book that I used when I was going to school 3 years ago. So the definition that's stated on this book, it says that COPD is a preventable and treatable disease that it's characterized by airflow limitations that is not fully reversible. So this disease actually could be acquired by exposure to noxious particles or gases, because of cigarette smoking, because of smoke, stuff like that. So primarily what happens is that all of these particles and smoke that goes into your lungs causes an inflammatory response to your lungs. So by doing so, it can create this disease in the long run, in the long term, pretty much. So there's actually, COPD is considered one of the obstructive disease in pulmonary diseases as well, because there's only five. The five of them, one of them is asthma, the other one is COPD, and COPD is actually divided in two diseases. One of them is known as chronic bronchitis, the other one's called as emphysema. We also have cystic fibrosis patients as well, and then this will be actually the five diseases that it's divided into. So yes, so let's also talk a little bit about the statistics as well. So COPD statistics. So COPD is the fourth leading cause of death in the U.S. Imagine that. So according to the American Lung Association, COPD is the fourth leading cause of death in the U.S. That's actually, I consider that actually being pretty crazy, considering, you know, that, you know, not a lot of people might not be aware what causes COPD. Not a lot of people that smoke, that vape, you know, having particles that go into your lungs due to smoking actually, you know, can be really, really bad for you. So it's something to look out for, you know, especially if you are somebody that has you know, that is a smoker, or it's starting to smoke, or has smoked for like multiple years and stuff like that. It's really important for you to know this information, I think. So in the U.S., over 16 million Americans have been diagnosed with COPD. Excuse me. So this information was actually provided by the Respiratory Health Association, which is one of the associations located here in Illinois. But I think that's actually pretty crazy statistics right there. Also, 8 in 10 COPD deaths are caused by smoking. So what does that information tells me is that majority of the people that are diagnosed with COPD are current smokers or smoked in the past. And so the severity of COPD, you know, it can be divided on like how many years you smoked, for how long you smoke, and also how many packs per year you smoked. So those are like important things that we look out for, that we always ask our patients, for how long they smoke and if they're currently still smoking as well. The other thing is that there's a statistics by Healthy People 2030 that states that 105.6 deaths per 100,000 adults. It's like the goal that we are reaching for, like as a nation, right? That's the goal that they're trying to reach as a nation. But in the state, actually, in the state of Illinois, we're like barely reaching that goal, because the statistics for that, it's actually 107. So we are barely reaching that goal, 107. So we're barely there to what the nationwide goal is. All right, we're gonna also be talking about COPD stakeholders in the state of Illinois. So I mentioned one of them before, which was the Respiratory Health Association, and the other one that I will be talking about today is the Illinois Department of Public Health. So the Illinois Department of Public Health and the Respiratory Health Association, they both work together and develop a state plan. And then this state plan is like a COPD action plan, pretty much. And it's like this plan was actually started in Illinois. So this plan serves as a guideline to reduce morbidity and mortality in patients with COPD and improving their quality of life in them. So morbidity means COPD can cause some other diseases, right? As I mentioned before, chronic bronchitis, emphysema, and mortality is just like the amount of deaths that we have within COPD patients. And the end goal of this plan is to pretty much reduce a couple of things: reduce mortality on COPD patients, reduce readmission of COPD patients, and also educate patients on their own disease, right? So they have a well understanding of what COPD is and how to treat it at home, how to manage that disease at home. They also develop a COPD Caregiver Toolkit. So this resource helps the patients and the healthcare provider obtain information about the patient management while living with COPD, prevention, treatment of COPD at home, and COPD action plan to avoid exacerbation, which is pretty much what I was just mentioning right now. So this Caregiver's Toolkit, it's important, right? Because every patient might have a different severity of COPD. So one of the things that for you to be able to diagnose a patient with COPD, you need something called a pulmonary function test. So for you to be able to diagnose patients with COPD, or for them to actually be treated for this disease, they need to have this exam done. So there's actually a high amount of our patients that come into the hospital that were smokers in the past, that they smoke for 20, 30 years and they still smoke to the day, but they have never had done a pulmonary function test. So the problem with this is that because we don't have the severity of their disease, which the pulmonary function test will tell us the severity of the disease based on a percentage, because we don't have this data, sometimes it's really hard for us to like treat these patients and have an appropriate action plan for them, because we might be treating these patients with usually what we do, right? We do albuterol and Atrovent, which both of those medications actually improve symptoms like wheezing, like increased work breathing, all the symptoms that we'll be looking on these patients. Both, we got albuterol, which is a bronchodilator, and we also we have Atrovent, which is a muscarinic agent, right? So both of these medications have like different pharmacokinetics and different pharmacodynamics that come into factor, but in the end, we might not know if this patient might need steroids at the time, or what happens if this patient is actually having a viral infection on top of their exacerbation that could be causing the COPD symptoms to be worse than what they're having right now. So it is really important that COPD patients or patients that have smoked in the past have a pulmonary function test, so for healthcare givers we can provide the right treatment for them. All right, so right now we'll be talking about the Respiratory Health Association and pretty much like their role. pretty much their role. So they have pretty much advocate for helping find like diagnosis of any kind of like lung disease, pretty much. So, and they're pretty much like a leader, right? They're a leader for advocating for those patients that were diagnosed with any kind of like lung disease. And I include all of like lung diseases at this point, right? I'm also including cancer, I'm including asthma, interstitial lung disease. I know these are like a lot of like big words for you guys, but these are just like different like lung disease that we will see currently in the hospital, like asthma, COPD, chronic bronchitis, emphysema, interstitial lung disease. This is like most common seen diseases in the hospital, or most common lung disease that patients come in the hospital with. Also, Respiratory Health Association developed a COPD Caregiver Toolkit, which we mentioned in the slide before, that helps patients and healthcare providers, treat patients better, have a better action plan and prevention for these patients. And the Respiratory Health Association has a vision and a mission, and those are to prevent lung disease by promoting clean air and help people live better through education, research, and policy change, which is actually, this is one of their plans for the state and the county, the state of Illinois and the Cook County, actually. It's to create better jobs or help people that work in environments, for example, that they're more prone of working in environments that might affect their lungs, So that's why they're working to create this program to promote clean air. And also their vision, it's healthy lungs and clean air for all. Pretty much that's what their vision is, which is kind of like related to their mission a little bit as well. And furthermore, I'll be talking about the respiratory health education and the advocacy, so what they advocate for. So recently, in 2019, actually before the pandemic started, the COVID pandemic started, they were trying to pass a law in the state of Illinois of the statewide Tobacco 21 law. So how does this, or pretty much like the law says itself, is to no longer sell tobacco to people under 21. So this is actually a really good law because you're preventing teenagers, you're preventing high schoolers, you're preventing people that are transitioning from like high school to like college to buy these products that affect the lung, pretty much. And they're also advocating to ban all sales for flavored tobacco products that include menthol and mint. And also they provide fund for smoking cessation and prevention of vaping as well. And one fun fact about this, they also, which is something that I mentioned on this presentation, but also the state of Illinois increased the taxes and tobacco products. And this increase in taxes is actually for people that are, of course, that are using tobacco. It's of course not they're not able to purchase this product because of the price, right? The price has gone up, and whoever is able to purchase like tobacco products, this money, it's actually being used to provide one of my actually recent papers that I wrote to my professor, this money is used to provide for children. It's for children foundations to help with children with disability, children's in need. So which is in the long run good. This money is being utilized for a good cause. All right. And also we'll be talking about one of the other things that they advocate for in their education. So the Respiratory Health Association Advocacy, they advocate for COPD patients, add a caregiving module to the Illinois Behavioral Risk Factor Surveillance System Survey. So how does this work? So the way it works is that when a patient comes in, just do like a quick interview. Try to understand, their behavior, like their tobacco use, all the stuff. So we have kind of like a baseline, right, of how this patient it's at the moment right now. And then for asthma patients, it increases funding for asthma management programs in schools. It secures funding to provide unsigned stock albuterol to all Illinois schools, and secures state resolution declaring May Asthma Awareness Month, pretty much. So the Respiratory Health Association is trying to make the month of May, the asthma awareness month. They're currently working on that as well. All right, so now we'll be talking about literacy in Cook County, Illinois. So there is according to the National Center of Education Statistics in 2022, there's 3 different levels of literacy in the state of Illinois. We have level 1, which is an individual that scores below 226 points. We have level 2, which is an individual that scores in between 226 points and 276 points. And we have a level 3, which is an individual that scores above 276 points. So I'm going to provide you with the percentages right now. So the percentages for Cook County, allow me 1 second so I can provide you with the statistics, okay? So that percentage for level 1 in the state of Illinois, it's 25%. And then so there is 25% of people that are located on that score below 226 points. The level 2, it's 35%, and the level 3, it's 45%. So there's actually a big percentage of people located on that percentage as well. All right, so let's talk a little bit about the literacy in Cook County, Illinois. Pretty much we're just touching base right now. So in Cook County, 25% of population are located on level 1. And then another 30% of people are located on level 2, which pretty much what I was talking about, 30. And then the plan pretty much will consist to target population located on both of these levels, right? Because both of these levels are the lowest levels. So the best way to address literacy on this patient population will be by creating a COPD plan. So pretty much following what IDPH and the Respiratory Health Association created, a COPD action plan, which it's already created, but at the same time trying to understand the patient's literacy level, so it's easier for them to understand that information that is being provided to them. So just so the patients are able to follow instructions and demonstrate medication use. I think that is actually really, really important. 2 things in there really important. It's if a patient it's listening to you and you're providing them information about their medication, but they're unable to use it and they don't understand the medical terminology, that's going to be a barrier for them, right? Because they will know how to use the medication, they won't use when to use the medication. So helping them in those situations will be important so we can prevent hospital admissions, right? Or like COPD death. Also, the plan should be elaborate these plans in Spanish and Polish, right? So why do I say that? Is because majority of our population in Cook County is divided, and of course we have people that speak English, people that speak Spanish, people that speak Polish. So having all of this like COPD plans on these 3 languages will help us because we can provide instructions to different patient population, and it will be better for them to understand these instructions under their native language, right? Instead of us trying to get a translator, sometimes translation might not be good for them. Also, we'll talk about the health literacy plan. So this is a little bit of research that I did on health literacy pretty much. And there's a study actually. This study was done in Spain, and it showed that 59 patients with COPD had inadequate health literacy. So a little bit of numbers here to throw to you guys. So in this study, there was 296 COPD patients. And then there were a couple of patients that were ruled out. But out of 296 patients, that percentage, it's really high, 59%. It's more than half of the patient populations that don't understand that they have literacy issues. And the reasons for this are multiple, right? So the reasons are because majority of the patient population are old, and 65, 70 and above years old. And also is because their ability to read, right? This population don't actually read instructions or follow manuals or stuff like that. if the patient will be a little younger. And to improve health literacy in COPD patients, we need to elaborate a questionnaire, in my opinion, that provides how patients manage COPD at home. I think this is really important because when patients are feeling well, when they're feeling healthy, when they're not feeling symptomatic, understanding what their baseline is will help us create a plan for them just to go home. Because some of these patients might go home on oxygen, 1, 2, 3, 4, 5, 6 liter nasal cannula. They might go on oxygen. They might need oxygen to go home, which is fine. But having them with an action plan will also help them create, or also help them take care of themselves in a more proactive way instead of being reactive to symptoms, right, when they're symptomatic. The other thing is this. So health literacy and COPD and the plan. So there's this same article that I was talking to you guys, that there's research done in Spain, develop a COPD assessment test, which is usually performed with the patient at baseline, pretty much, what I was mentioning before. And that, this questionnaire provides insight on what patients know, and it also helps healthcare providers find out if the patient has low dependence, some dependence, moderate dependence, and high dependence. So this is targeted for everybody, right? And, if you have an adult, 65, 70-year-old adult, this patient, with different characteristics, he might live with his wife or with her husband, and if they're around the same age, there might be people that might require some moderate or some high dependence, which means they might need somebody that helps them on their daily on your activities of daily living. They might need someone that helps them, take medications and stuff like that. So this is some important things for us to know. So once we provide information to these patients on their healthcare or on their care at home, for us to help them create that plan that works best for them, pretty much. And I'm sorry, I think I passed a slide right here. Yes, I think I passed a slide right here. So address healthcare literacy. There we go. I'm so sorry. Yeah, there we go. Okay. So in here we were pretty much what I was mentioning before. Just follow the study done in Spain. Perform the questionnaire when patients are stable. Create a baseline for them. Find a suitable learning material for each patient. I think this is something really important. Of course, depending on patient population, right? We have people that love reading. We have people that love doing puzzles, So what that tells me is that we have different type of learners, right? We have visual learners. We have auditory learning. It's just multiple learning processes for this patient. So I think this is really, really important. And also, I would like to touch in conclusion, right? So in conclusion, a way to prevent COPD deaths in adults is identify patient literacy can prevent medication misuse. I think this is really important because medications have side effects, right? If you do take a lot of albuterol, one of the side effects is tachycardia. Tachycardia, it's increasing heart rate. So if you have a patient that already has a cardiac arrhythmia, which is like a comorbidity, majority of these patients probably do, they have cardiac arrhythmias, they have high blood pressure. So understanding that, you're taking a medication and understanding their side effects could prevent you from using this medication multiple times and actually worsening the symptoms on the patient. So I think that's really important. So the COPD management plan created by the Respiratory Health Association can improve, provide guidance. Usually the guidelines that we use to treat COPD patients is we follow GOLD. So the GOLD Association, it's actually like statewide, So, which is, I didn't touch base on this a little bit, but pretty much that's how we manage and treat patients. So the GOLD Association is the global. I'm sorry. Let me tell you guys what GOLD stands for. The GOLD Association is the Global Initiative for Chronic Obstructive Lung Disease. That's what it stands for, and that's what we use to actually treat these patients, COPD patients. Following COPD preventing COPD hospital readmission is following appropriately the COPD action plan helps reduce hospital readmission and death, which I think this is really, really important. And also improving health literacy should be our primary goal. And this is important in short-term goals, long-term goals for every patient population. In my opinion, health literacy is so important because it helps patients learn more about their disease, helps patients identify better their symptoms, and finally, a better health literacy will enhance patient care. And in my opinion, and yes, I'm gonna show you guys my resources. These are my resources that I use for this. Thank you guys very much for your time, and I hope you guys have a great day. Thank you.